So the format of today, I'll be doing a presentation and hopefully it won't take too long, and I'll take questions after. So during the question time, do put your questions in the chat or you can put your hand up and we'll come to you in order. And I do also have a frequently asked questions session oh gosh, I've just said that I'm getting an update on my computer. Oh dear. I don't know how to get rid of that. Let me just bear with me one moment. Oh, no, it's not doing it. Okay, that's good. So I'll be doing a presentation, take questions after, and I do have a frequently asked questions section in my presentation. So hopefully there might be some questions you have that will be answered there. And they've come from some questions I've been asked so far over email. So hopefully that will be able to cover that. So who are UOK Brighton Hove? So for those people that don't know, we are your local mental health and wellbeing support service, and our contract is funded by NHS Sussex and Brighton Hove City Council, and we are led by Sussex-based not-for-profit Southdown. So in Brighton Hove, we currently offer mental health and wellbeing support for people 18 plus, adults. So we have 4 key pillars to the partnership. So that's advice, information and guidance, getting support, community development, prevention and promotion, and lead provider. So Southdown is the lead provider. Under advice, information and guidance, we have a central access point. So this is managed by Together Co, our partner, who have a phone number and an email address that anyone in the city can contact and get access to information and advice about local mental health support. We also have money advice. So this is for debt, benefit and welfare advice. We have suicide support or rethink mental illness. We have Quell, which is a digital service, and that's for people to get support online, either by one-to-one chat or by forums and other peer-related tools on there. We have Getting Support. So this is where this piece of work will fit in. So this is psychosocial one-to-ones and group work. We do a lot of drop-ins, so that could be a youth advice drop-in. We have a drop-in specifically for women, people who identify as female. We also have wellbeing activities. So these are led by many of our partners who deliver wellbeing activities across the city. And we have employment support. So this is employment support for people with a diagnosed serious mental illness through our individual placement support service. We also have community development, prevention and promotion. So this is the newest area of our partnership. So we run events, we have campaigns for awareness days and other things throughout the year. We have training that's delivered by Grassroots Suicide Prevention and some of our other partners. And we're really aiming to connect with and listen to our communities to understand what their needs are and what we can do to innovate and to really build those services that meet their needs, as obviously a really key piece of information. And then lead provider, so we have co-production. So this is, again, listening to communities, making sure that we are co-producing our services and that they are informed by all of that information. And we have the lived experience advisory group integrated within the partnership. So they're fantastic and they give us a lot of support and advice. And then we have language support as well, and this will work really closely with this project. So this is delivered by Sussex Interpreting Services, or SIS, and they have a pot of funding that they can dip into to get translation and interpreting support for our partners. So that's a really well-used element of the service. So this is our partnership at the moment. Beautiful array of lovely logos there. We have 21 partners in total, and this service will be another partner if they are successful. So this opportunity that we'll talk about today is community mental health and wellbeing, a community mental health and wellbeing service for migrants, refugees, and asylum seekers, and we're using the acronym MRAS. So if you see that, that's what that means. This service is currently delivered by the Trust for Developing Communities, or TDC. They've been our partner since the contract first started in 2019. We're now on a new contract, and they are delivering this piece of work, and they will be passing on their clients to the next service if they're not successful. So this service will be based in Brighton Hove. We just want people living and working in the city. And it will be delivered by a VCSE, voluntary community social enterprise organisation, or organisations, with one organisation as the main contact. And we will focus on accessible, culturally informed support, making sure that all services are fully accessible and that people are able to access them. Because as we know, migrants, refugees and asylum seekers are not best placed to access mainstream services. They do need that focus on that culturally informed support. So why does this project matter? I think we all know why this project matters, but just to go through some of the key reasons. Migrant, refugee and asylum seeker communities face trauma, they can face displacement and isolation. They could have recently moved from their home country and not have the clear idea of how to access mental health and wellbeing support in the city. They could also have language barriers, of course. English isn't everyone's first language, and they could face difficulty accessing services and have had multiple disappointments with trying to do so. They could also be affected by poverty, housing instability, and discrimination. There's obviously, unfortunately, been a lot of things in the media recently about discrimination and racism, and some really awful things. And this is what this service aims to really support people with and be completely accessible. And there's also, as we know, gaps in accessible and culturally appropriate mental health support. So there's perhaps where statutory services or mainstream services just can't meet the needs of these communities. So that's really what this service is aiming to do. So the aim of the project is to improve mental health and wellbeing, is to reduce isolation, provide early support, hopefully preventing crisis, and the need to access services at crisis point. It also helps people navigate services. So there's a whole, as we know, there's a whole array of services out there, but it's actually helping migrants, refugees and asylum seekers to understand what's right for them and how they can access it. And also, as I've said, to reduce inequalities in access, which is really what UOK Brighton Hove is here to do. So just a bit about the service offer and delivery. So the target group will be people with low to moderate mental health needs. So that could be anxiety, stress, or depression, for example. It's not for people with really severe mental health needs, just because we need to be that culturally informed community support that's really that preventative element. And so what the service will deliver, so it's the model that TDC, Trust for Developing Communities, have been delivering that's worked really, really well. This is based around that. So it's one-to-one support for people, peer support groups. These could be themed or other sort of peer support groups that you're able to set up, or you could already be delivering. And navigation and signposting to relevant services. So you may have seen a website called Migrant Help. That's a Brighton Hove website that's actually been created by Trust for Developing Communities and Brighton Exiled Refugee Trauma Service and HERA when they did the Integrated Migrant Pathways project back in, I think it was 2024 now, quite a while ago. So that website is accessible for people to find that information and navigation. And the key delivery principles are that it should be trauma informed, the service. It should be culturally appropriate support, of course, that's really, really important. Have clear, accessible language. So this can be supported by UOK Partner Interpreting Services, as I've said. It really does need to be completely, the most basic language we can use and nothing too clinical, because it's not a clinical service. And also built on community trust and relationships. So this is what we'll be really looking for in the expressions of interest. We really need to see those local relationships and how you've built trust in the community. And also partnership working across the city. So we work as a partnership. This is really, really key for delivering the best kind of services. We realise that no one organisation can meet the needs of someone, all in one go. People also have, related trauma and other things that they need support with. So it's really being able to rely on other services to work in partnership and provide the right support for people. So how applications are assessed. This is a really key and important thing. And as I said, we're really using lived experience within the partnership within this contract. So what will happen is that the applications will be assessed by myself and my team here at Southdown, and they'll be shortlisted and anonymised. So there won't be any kind of service names or anything that would relate for someone to know what your service is. Obviously, people might have an idea from the application, but it's really key that we do this just so that it's completely fair and that people don't have any bias against, oh, I've been to that service and I really liked it, and that's what I think I should sort of go for. So it's really important that we do that. And then these will be sent to a panel of people with lived experience of being a migrant, refugee or asylum seeker in Brighton Hove. And this will be supported by Possibility People. So Possibility People are very kindly building us a panel of people with lived experience. And there'll also be people with lived experience who aren't from those communities, just for fairness. So the application will be scored on understanding of community needs, and this is all in the EOI. The quality of the delivery approach, community trust and relationships, partnership working, and reach and impact. And that could be a project that you've already been working on, or it could be something new. So the timeline is as follows. So the deadline is the 11th of May. Please do submit them by 9 a.m. Because we've got a bit of a sort of process to obviously take the applications through. And then the decision will be late May, and we will get in touch with you. Oh, sorry, is the slide deck not moving? Is there a timeline on your screens? Can you see that? Oh, perfect. Okay. So I just saw something in the chat. And then the mobilisation will be from June the 1st, and the service will work with our current provider to transition clients if that's needed. And then the service starts in July, and it will be fully operational. We intend for it to be fully operational by September. Just recognising that small organisations really don't sometimes have the capacity to get everything up and running straight away. We just want to be really inclusive of and be thinking about that. So measuring impact, this is obviously a key thing for us because we have commissioners. We have, this funding has been given to us by NHS Sussex and Brighton Hove City Council. So measuring impact is really, really key. So the chosen provider will work with Southdown to set key performance indicators, otherwise called KPIs, and decide on impact measurements. So how that's happened with our partners within this contract so far is that we go to the partners and we say, this is the basics of what you would need to record, but how do you think this can work? And we really do put it back to that organisation and ask them what would be the best way to measure that impact. So it's really a good way of doing it. So these are examples. So it could be number of people supported. There's no set number for that. It's really what is realistic. How many people from your experience do you think you could support within this funding envelope? There's group participation. How many people have attended groups? What was their feedback? Improved wellbeing and reduced isolation, and confidence accessing services. So this is obviously more of an impact measurement and outcome measurement. So just to take you through some frequently asked questions, so these are some that I've had over email, and I just thought it'd be good just to pop them in here. But we do obviously realise you probably have further questions that we can answer afterwards. So one that I had was, do we have to deliver all three elements? That's one-to-one, groups and navigation. And ideally, yes, please, because the model is designed to combine all three. So we feel like this is the best way to work with these communities, but we're obviously open to how you work with them already, and just they'll be sort of judged on how robust the service is. Can we design a service in our own way? So yes, this kind of goes on to that. So yes, as long as it meets their aims and principles. So as long as it is culturally informed, trauma informed, and culturally appropriate and accessible, then yes. So I've said the word accessible quite a lot today, haven't I? That's my most used word. Is there a required number of participants? So no, there's no fixed number. You can propose realistic outputs in your application. And then another one I had is the £37,500 per year or total, and that is the total funding across the funding period. So that's the whole 2 years. And the delivery needs to start mobilised from June 2026, delivery from July, and then fully running from September. And the funding can be used for staffing as long as it supports the delivery of the service. And also I've actually had this question a few times. So there's a few smaller providers who've wanted to apply. And we do just say that you need to apply together and for a whole amount. But one organisation would usually act as the lead applicant. So we would just have that relationship with that one organisation to set everything up, just obviously realising that it's a lot to manage. So it would be great if everything just came through that one organisation. And how to apply. So this is all listed on the expression of interest, but you need to submit the expression of interest via the application form that was attached to the original email. And then you need to send it to brooke.joyce@southdown.org by the 11th of May, please. So thank you. That's enough from me. I would love to take any questions if you have any. So please do put your hand up